Assalamualaikum warahmatullahi wabarakatuh. My name is Siti Ainul Nurizzati binti Zamri, and my group members are Nur Fatiehah binti Jaafar, Nur Fasihah binti Azmi, Devieyvnna Anak Mawing, Hanis Masitah binti Bakri, and Ulin Nuha binti Ahmad Badri. And our group are going to present about Mayo Clinic Archive.
Assalamualaikum, my name is Nur Fatiehah and I am from IMR455. Today I would like to talk about the Mayo Clinic Archive and Record. The Mayo Clinic is a non-profit American academy of medical center focused on integrated healthcare education and research. The Mayo Clinic is an external, public-facing news site that provides consumer press, health recommendations, scientific research, new releases, and patient tale. All information is provided to inform and educate the general population. The general public is not required to register in order to use the site. Mayo Clinic researchers contribute to a better knowledge of disease processes, optimal clinical practices, and the translation of laboratory findings into clinical practice.
Hi and Assalamualaikum everyone. I am Nur Fatiehah Azmi and I will explain about acquisition and collection in Mayo Clinic. First of all, acquisition is an archive term which means the process of taking material into your collection through several methods. The methods are transfer, donation, or purchase. In acquisition, there are two approaches to archive, which is passive and active approach. For the donation procedure, start with conduct a record survey to identify and separate any permanently valuable record. The archive staff can assist with the donor to establish which documents are of lasting importance and advise the donor on how to do so. Secondly, they need obtain boxes and material which sent to the archive must be sent in record center box. These boxes are available from Lawson with the stock number 291693. Thirdly, number and fill the boxes in the next step. Each package should be numbered. Fill in the blanks from the front to the rear. When arranging record chronologically, start at the top and work your way back. When arranging record alphabetically, and start at the beginning of the alphabet and work your way back. The next step is the need to label the boxes with the information according to from, to, and box number. From, we have to mention the department or office name. To is the W. Bruce Fire Center for the History of Medicine, number 315, and box number. The second last step is the donor has to make a container list of the box contents. The box content list should begin with the box number followed by title of each folder in the box, exactly as that state on the folder. These loose items as a group in the order in which they were discovered. Insert the container list into the box and repeat as needed. When the box are ready for delivery, email Nicole Baycook, the electronic version of the container listing. And the last procedures are arrangement for the donor delivery the record to the archive. Record can be delivered in a number of different ways. The ways are self-delivery to the archive, and the donor can contact Nicole Baycook to arrange a time, and campus mail is the way material up to 750 lbs and will be delivered through general service to the archive, and the other way is archive pickup. In this way, the archive may be able to get modest volume of archive material depending on available resources, and please contact Nicole Baycook for availability information. Collection material are often organized by term with a material on a single topic gathered together. In archive, collection information about a certain subject may be dispersed among many collections. Archival collection are arranged according on two basic principles, which is provenance and original order. Provenance requires that documents from various origins be maintained apart from one another. This means that record from one person or institution should be kept apart from record from another person or institution, even if the subject matters is the same. The second one is original order. Original order is denotes archival documents should be kept in the order specified by the author of the record rather than order created by the archive. And in Mayo edition collection, most of the record is original from the staff and musician. Last but not least, the collection policy in Mayo Clinic is seek collection for patient balances from patients who are able to pay for these treatments. Procedure for collection shall be implemented uniformly and equitability to all patients regardless of insurance status. All collection techniques shall be in accordance with the applicable laws and the goal of Mayo.
Next is appraisal and disposal of Mayo Clinic archive. In this case, Mayo Clinic is using Clinical Research Appraisal Inventory (CRAI) as a self-evaluation instrument, and the data is collected, analyzed, and the results are stored in database. Mayo Clinic are doing appraisal process by doing systematic reviews, meta-analysis, evidence profiles, and clinical practice recommendations. While disposal is a process of destroying or retaining records. When records are no longer needed for management purposes, they should be disposed of as quickly as possible. By doing regular disposal, destruction, and transfer of inactive records to storage facilities allows office space to be used more efficiently. In this case, Mayo Clinic records retention is different for each type of records. While HIPAA is the Health Insurance Portability and Accountability guideline that must be complied in medical industry, including Mayo Clinic. For disposal of records, Mayo Clinic are using secure paper shredding, hard drive destruction, product destruction, and X-ray destruction by the Healthcare Waste Management Service. Next is accessioning. Accessioning happens when collections are physically and lawfully exchanged to an archive. In Mayo Clinic, RHIT, which is Registered Health Information Technicians, are responsible in accession registry. RHIT also have 10 years of experience in healthcare business, including customer service, quality control, and health information. Some of the processes are keeping the hard copy and digital records, obtaining information, and supplying outside entities that permitted to receive. Mayo Clinic also developed management solutions by mapping resources in tracking provenance of records. On patient level, Mayo Clinic decided to set IDs for records, specific IDs for records. For example, of specific ID is accession number. For accessioning, legal control, physical control, and intellectual control are important. The first one is legal control. Example of legal control activity by Mayo Clinic is the contract or agreement with Mayo Foundation for Medical Information and Research at Minnesota. Next one is physical control. For example, Mayo Clinic use shipping by FedEx or AirNet to ship the document or record. And the last one is intellectual control. Mayo Clinic identifies patient records and medical information as material that they held. Mayo Clinic archive also deals with only medical and hospital subject only. Next is arrangement and description of Mayo Clinic archive.
My name is Devieyvnna Anak Mawing, and today I'm going to continue for the next presentation, and my point is arrangement and description. The arrangement and description is to examine and study how the processing Achiever institution have been arranging as well describing its own materials to available for keeping in its custody. It will arrange it according to the principle of respect, specifically for the provenance and original order of archive. It also will documenting in archive may be held by an achiever institution. In terms of Mayo Clinic simply arranging the record that have been used and created by involving the processing of archive in the set of complex in terms of healthcare institution. The Mayo Clinic as well has provided in the archive with the commenting of records as evidence in organization with the accurate and reliable information within provenance and original order, as well to protection over the materials. As an example, the Mayo Clinic has provided the commenting order healthcare that manage and processing within a fancy set of clinical data as well physical developing innovation. The principle of description is specifically into the processing that analyzing, organizing, and recording the records information in archive. Every detail of data regularly being processed within well-identified achiever resources as an institution in archive, which is we describe the significant record set broadly available for the collection of material with smoothly organizing with data. The Mayo Clinic has arranged the record of data in archive by organizing and producing the documenting writing form of summary plan, description, and legal notice. Its will planning with the authorities as well human responsibilities for the requirement of administration plans of archive. As an example, the effective summary plan description by the Mayo Clinic or Mayo Medical Plan, Mayo Resupplement Plan, long-term disability, and life insurance that be established as an organizing in the 1st January of 2019. I will explain for the preservation and storage. The preservation is process that competency to undertake the maintenance, repair, as well covers the achiever materials. In the term of Mayo Clinics that be launched, or as well establish the 5-year program that known as Land Loss and Preservation Registry. Simply it for the medical information, the accuracy and reliable basement treatments for patients. The example of its traumatic injury, diabetes, and any of medical condition. And the preservation will collect the available resources for the limb it's lost. It will developing the user analytic tools for maintaining the preservation. For the storage is simply the best as where the beta careful that capable to protect within goodly and safely every preservation item and material in achiever is storage of the holdings. In the Mayo Clinic, it indeed provides the storage for beta protection of any data, document as well the records of health and pension that will protect its direct located of storage. As an example, the creation of PHRs, EHRs, and patient portals. Electronic health records EHR is maintained by the doctor office, hospital, and at the health insurance plans. However, PHRs is managed at the patient health between the visit of patient as well as the information and privacy of resources patient.
Now I will explain about access and reference service. The word access refers to the term and condition under which audio-visual material is made available for viewing and reuse. Access requirements include the provision of proper metadata for audio-visual access of sequences as well as the clearance and management of rights. And then, the praise reference services refer to the facilities and services made available by the archive after access to the material is allowed. Enabling users involve AD resources in locating and selecting appropriate material, offering efficient delivery methods for commercial and public access and when necessary. Mayo Clinic have created a general access or referral policy for their user that define who has access to the material. Requests for viewing and reuse also restriction that exists. Mayo Clinic has set the number of material that can be viewed at one time by the user. Permission are required for the material use. The user have access to archival installation in Mayo Clinic library, mostly from students, researchers, and for education purpose. For the copyright, Mayo Clinic does not assign the right to any Mayo copyright drawing, graphic, questionnaires, or survey instrument contained in any article submitted by Mayo writer according to Mayo policy. Mayo Clinic also provide the publisher a perpetual non-exclusive, royalty-free permission to publish such content in any media as part of the submission. Mayo retain a right to such works except this non-exclusive license. For other general knowledge, reference service are the facilities and service provided by the archives once access to the material has been granted. At Mayo Clinic, they have provided a lot of referral services for the users to support material. In the virtual visit, we has figured out 112 database in the Mayo Clinic library. In Mayo Clinic, they use a to Z database with arranged by alphabet. Mayo Clinic also have W Brooch File History of the Medicine Library. The W Brooch File History of Medicine Library is a specialist library that has significant collection on the history of medicine and associated field. The core collection of primary literature on all aspects of medicine and associated profession includes several thousand volumes. The balance of the collection, 23,000 total volumes, include more recently published history, biographic, facsimiles, and other supplementary materials.
Outreach activities are designed to engage a large audience, disseminate knowledge and expertise on a certain issue. School presentations, workshops, public discussions, and lab visits are all examples of outreach efforts done by Mayo's Clinic. Mayo's Clinic ongoing aim is to keep healthcare local, the background of their outreach effort. They collaborate closely with healthcare providers to sustain and develop outreach programs. As stated, Mayo's Clinic engages in a variety of outreach programs such as prenatal care program. Somali Cares is a group prenatal care program for Somali women. It is taught to women through interactive seminars led by a team of doctors, midwives, and nurse educators who employ role-playing. Moreover, Live Well, Be Well is one of the community initiatives and education programs targeted at enlightening African Americans about cancer and the necessity of healthy lifestyle. Mayo Clinic also has a strategic partnership with The Links Incorporated, which promotes and facilitates projects that promote good health. Also, at their Mayo Clinic sites, many Mayo Clinic workers volunteer and support community programs.
This part will explain about the strength and weakness of Mayo Clinic archive that should be improved. Besides, it will explain about the opportunities that every medical head should be improved and the threat should be avoided for every medical head to protect their documents. Mayo Clinic should do this SWOT analysis in order to strengthen their archive system in greater depth and detail in order to avoid future problems. This SWOT analysis prepares to face future challenge. Healthcare is a fast-paced, ever-changing sector. We will have a difficult time traversing the trenches if we are not prepared for upcoming change. Fortunately, SWOT is designed to be proactive. We can plan and anticipate future risks when we sit with our team and examine potential challenge to our progress and profitability in the future year or more. Firstly is strength. In this Mayo Clinic archive mainframe have a large data storage and processing capabilities. The banking industry has traditionally employed mainframes to process and record transactions. This is also true in the healthcare industry, as patient data is eventually held in a single government repository. In Mayo Clinic, they have personal health records and patient portal, which means which mean they have basic personal record for every patient who come to their clinics. They have an app for iPhones called Health that contains medical ID, which make essential information available via the lock screen for first responder to use in emergency. Medical ID can include information such as medical issues, allergies, prescriptions, blood types, and emergency contact information. Next is weaknesses. In this Mayo Clinic archive, they have low levels of security. Hackers from all over the world can gain access to someone else's data by hacking into low-end clinical data repositories, server-based. As a result, there is now an identity dilemma and invasion of privacy. As a result, the level of digital security must be improved. Through their documents, hacker will easily get the information, and the process is not too complicated for user. It is feasible to add security elements to their storage system to prevent unwanted access or theft. Features like movement sensing and a built-in lock are available on mobile shelves. Pin codes and RFID tags can be added to electrical circuits. Next is opportunities. Opportunities for improvement in the Mayo Clinic archive should have more effective security protocols to develop. For any modern culture or company that relies heavily on digital or electronic form of functioning, security is both a necessity and a threat. To avoid invasion of privacy and malpractice involving an individual's clinical data, security problems must be addressed. This can assist Mayo Clinic in safeguarding crucial documents from unintended consequences. It protects from losing data, such as client trust. If they misplace files containing personal information about their customers, or the files are stolen, not only it affect their relationship with those customers, but they could also face a hefty fine. And lastly is threat. In this Mayo Clinic archive, it should concern about security. The biggest threat to the clinical information system sector, as previously said, is malpractices involving other people's data. As a result, the threat of hacking to digital security must be addressed. When it comes to the adoption of electronic health records in the health industry, the privacy and security of patient information is the most important obstacle to overcome. This should be protected because every clinic must preserve medical records for a long time. It is usually best to store them off-site in order to free up valuable space on their facilities. Because medical records contain very sensitive personal information, they must be kept in a safe environment.
In conclusion, Mayo Clinic can improve their records and archive in many ways. In order to successfully encourage the preservation of digital information, archivists need a better knowledge of computer science. The recommendation made for the Mayo Clinic are for the greater sharing of reuse for the public. We hope that archivists can continue to improve further so that people will feel ensured that the archive can be used and that the potential protection of our society information output will be safeguarded.